Chapter 2, Social Security Disability Insurance, better known as SSDI. Social Security Disability Insurance can only be applied for when you are unemployed, has received state disability if living in California for at least 52 weeks, which is a year, for a medical or mental condition which the individual is not able to work in the work field indefinitely. Applying for SSDI. Call the Social Security toll-free number at 800-772-1213 between the hours of 7 a.m. to 7 p.m. Pacific Standard Time, Eastern Standard Time, Mountain Standard Time, and Central Standard Time. Secondly, when speaking to a live representative, tell them you are totally disabled and would like to apply for Social Security Disability Insurance. The representative will ask you for the following information: your Social Security number, your legal given name, your place of birth, your mailing address and telephone number, your date of birth, and finally your mother's maiden name. Then the representative will repeat the information that you gave to see if everything is correct. The representative will tell you that an application for SSDI will be mailed within 7 to 10 days, respectfully. Once you receive the application, you should go to your medical physician to assist you in filling out the medical portion. The physician will diagnose you, the patient's medical condition. The physician will order additional medical procedures such as blood tests, x-rays, MRIs, etc. Also, your work record is a very important factor when applying for SSDI. In order to determine your SSDI benefits, be sure to write your work history correctly. Work history from age of eligibility to work until the present. The SSDI process after the preparation. You will receive a work history report. You will also receive a daily questionnaire. These documents will come from Social Security. Work history report. Social Security has all of your work history from your first job to your last job. The work report wants to determine if you have been employed since you have applied for SSDI. Did your job require lifting? If your job required any lifting, how many pounds did you lift in an 8-hour day? Your job title. And lastly, description of your job duties. After you have received the work history report and daily questionnaire, contact the SSDI analyst who is handling your disability claim. Then get their permission to fax your documents that was mailed to you by the Social Security Administration. If you have any tests, x-rays, documents including history and physical, or any medical records needed to support your case. Preparing yourself for a Social Security disability exam. When you prepare yourself for a Social Security disability exam, you should do the following things. 1. Depending on your medical or mental condition, please have current tests, x-rays, MRIs, blood tests, or CT scans. Secondly, make sure that you are within a 6-month period with recent medical records. Third, get your own copies of medical records from the agencies that are performing the procedure or the needed procedure. Please take the medical records to the disability exam. Things to take to your exam for a medical or mental condition. Number 1, for a heart condition, take your current EKG, electrocardiogram, your echocardiogram for a mitral valve prolapse, and all of your prescribed medications, as well as the over-the-counter and current lab results for blood tests, etc. Number 2, for a back condition, take your current MRI, CT scan, or x-rays of the lumbar sacral spine. Include your prescribed medications as well as over-the-counter medications. If you had physical therapy, describe what type of physical therapy, whether it was electrostimulation, hot or cold packs, massage, or dietherapy. Number 3, for a mental or psychological disorder, You need to bring all of your medical records from your psychiatrist or psychologist. Bring your prescribed medications. With a mental disorder, you could be treated for severe depression, manic depression, bipolar, schizophrenia, or schizoaffective, post-trauma stress disorder, or depressive neurosis. Please include all mental exams such as mental testing, blood levels of medications, etc. Number 4, for a seizure or epilepsy disorder, please bring all your medical records from your neurologist. Please include test results such as CT scans of the skull, EEGs, electroencephalogram. Be sure to bring your Dilatin, Depakote, or phenobarbital blood levels of your medications. Please include the frequencies of your seizure or epilepsy disorders. Daily questionnaire for SSDI. The daily questionnaire will ask many questions about your daily activities. Where do you live? With whom do you live? Do you drive a car? How far can you drive? How far can you walk? Do you do grocery shopping? Do you do household chores? What do you do in an 8-hour day? What medications are you taking? What are the dosages of your medication? Can you lift anything? If you can lift, up to how many pounds? Pain questionnaire for SSDI. The pain questionnaire is a questionnaire that determines the degree of pain in your medical condition. That is, sent by the State Office for Social Security. Question 1, where is your pain? Question 2, how long does your pain last? Question 3, what kind of pain? Is it a sharp pain, an aching pain, excruciating pain, stabbing pain, throbbing pain? Question 4, the levels of your pain. On a scale of 1 to 10, is it standing pain, sitting pain, lying down pain, walking pain? Question 5, what time does the pain that you have occur? Is it nighttime, morning time, all the time, all day long, all night long? Question 6, how do you relieve your pain? Is it by over-the-counter medications found in drugstores or pharmacies, or prescription medications written on a prescription by your medical physician? Types of pain. Number 1, chest pain pertaining to the heart muscle or digestive tract, indigestion, heartburn, dysphagia, etc. Number 2, back pain pertaining to the lumbosacral region of the back. 3, arthritic joint pain, knee, shoulder, hip, leg, etc. 4, migraine headache pain in all the lobes of the brain, temporal, frontal, occipital, and parietal. Number 5, injury pain, such as sprains and strains of the muscles and tissue. Number 6, abdominal pain, stomach, gastric, duodenum or peptic ulcer, pancreas, and liver. Number 7, internal organ pain, gallbladder, kidney, bladder, uterus, prostate, rectum, and anus. Methods of relieving your pain. Pain medication, physical therapy, electric stimulation, hot or cold packs, massage or diathermy, braces, crutches, canes, wheelchairs, scooters. When going to the state doctor for Social Security disability, 1, have a current driver's license or state identification card to properly identify yourself. Secondly, bring a copy of your letter with the appointment to see the state doctor. Third, you will be given an information form to fill out when you arrive there. Fourth, after you have filled the form out, you will then give it back to the front desk personnel. And lastly, then you will wait for your time to be called to be seen by the state doctor. When taking the SSDI exam, 1. The physician will ask you to identify yourself with a current state identification card or driver's license that must include a picture. Secondly, date of birth. Third, the physician will take your vital signs, blood pressure, weight, and height, and your temperature. Number 4, the physician will ask a series of questions about your medical condition. 5, the physician will ask when you last worked and what type of work you were performing. 6, with your condition, could you work less hours or take a sit-down position? 7, the physician tries to confuse you. That is, even if you are disabled, you can work. And number 8, no blood work, EKGs, X-rays, or any tests are given at the exam. When you are approved for Social Security disability, you will receive an award letter, a letter that grants you an approval for Social Security disability benefits, which will give you your monthly benefit amount. You will also receive a telephone call from your SSDI analyst in your local Social Security office to come into the office for an SSDI approval visit. During the visit, your SSDI analyst will explain all the information about your SSDI approval. You will be given a period of approximately 8 weeks from the SSDI analyst before you receive your first monthly benefit check. Your SSDI check can be directly deposited to your bank or financial institution of your choice, or it may be put on a Social Security debit card. Maintaining your SSDI after being approved. First, continue to seek your medical care from your current physician. Take all the procedures that your physician requests, blood tests, EKGs, X-rays, MRIs, etc. If given medications to take for your medical condition, be sure to comply with your physician's directions. Try to make monthly appointments to get regular checkups. Always confirm your appointment on the day before your appointment. When you can't make the appointment, call your physician's office to reschedule your appointment. Please note, to all SSDI beneficiaries, the Social Security Administration could call you in for an evaluation at any time to make sure you are still disabled. Under the guidelines of the Social Security Act, you have to be totally available and prepared for your SSDI interview. Sometimes the interview may be done on a random basis. How to get approved for SSDI once you've been denied. First, you have to produce new medical or mental information. Secondly, all information has to be current. Third, call the state capitol in your state for their Social Security office. Ask the state Social Security office to reopen your SSDI case. That means to locate the office of Social Security that denied your case. If the office reopens your case, you will go back to the state physician. You will be reevaluated. The doctors will realize that an error has occurred. You will then be granted an approval for SSDI. When your SSDI claim is denied, number 1, you will receive a denial letter for SSDI in the mail. Secondly, you have 60 days to make an appeal. You can request a hearing. You can go to a hearing before an administrative law judge, or you can do a reconsideration, that is to explain why you disagree with your SSDI denial. And lastly, reopen your case by calling your state capital's Social Security office to locate your case so that it may be reopened and be reevaluated for errors. Reason for SSDI denial. Under Social Security guidelines, when you are denied, you didn't meet the requirements for a disabled person, according to the Social Security Act. If denied for SSDI, call the Social Security's toll-free number at 800-772-1213 for a reconsideration form. Secondly, request a legal hearing by an administrative law judge or a regular hearing before a state panel for SSDI. Hearing time limit. If you are going to file a hearing, the hearing must be done within a 60-day period. Hearing processing time for SSDI. The hearing processing time could take approximately from 60 days to 12 months, depending on the disability claims that are already pending. The administrative law judge has to look for an open appointment on his or her hearing schedule for availability on his or her calendar. It could take up to 60 days to 12 months. Please note, when you don't qualify for SSDI but do qualify for SSI, 1. Your local Social Security office will send you a denial letter for SSDI. 2. Afterwards, you will then receive an approval letter for SSI from your local Social Security office. The Social Security office will then schedule you for your approval appointment. At that time, the Social Security office explains the reasons for your SSDI. Thirdly, the representative will tell you that under the Social Security Act, a person needs to have 40 points to be declared disabled for SSDI. You didn't have 40 points. 4. But you were found to be disabled by the Social Security state doctors. You can only qualify for SSI. At the closing of your SSI interview, you were told when you should expect to receive your first monthly SSI benefit check. And lastly, if you qualify for SSI back pay, you will receive it following your SSI benefit check. Frequently asked questions about SSDI. Question 1. What is Social Security Disability Insurance? Social Security Disability Insurance is when you have worked in the employment market and have become disabled and aren't able to work anymore. Question 2. What is totally disabled? Totally disabled is when a person is not able to work due to a medical or mental condition. Question 3. What is work history? Work history is from the age of eligibility when you are able to work at least from 18 years of age to the present. Question 4. When will you receive the disability application? You will receive the disability application within 7 to 10 days. Question 5. What is the difference between an office appointment and a telephone appointment? An office appointment is when you are scheduled to go to the local Social Security office in your area where you reside. A telephone appointment is usually done in your place of residence by a Social Security representative from your local office, calls you on the telephone. The times of the appointment may vary from the morning or evening, whichever you should prefer. Question 6. What happens during the 30 to 90 day period? The 30 to 90 day processing of your Social Security disability application is the processing period for SSDI. The claim will be thoroughly reviewed during that time. Question 8. What happens when you are approved for Social Security disability insurance? When you are approved for SSDI, you will receive your benefits for SSDI within 8 weeks from the approval date. Documents that are needed on approval: you will need your original birth certificate and your current state driver's license or state identification card. Please note, determination of disability benefits. To determine your SSDI benefits, you must have acquired 40 points during the quarters of your total work history. The Social Security takes the lowest wages of your first 10 years. Then they will deduct them off. Question 9. What is an award letter? An award letter is a letter from Social Security with the monthly benefit amount that you will receive. It will be mailed to you. Question 10. What is direct deposit? Direct deposit is a relationship between your bank and Social Security for you to receive an electronic transfer to the bank for your monthly benefits.